Well, welcome everyone to our final NAMI at noon of 2024. I'm Amy Brundle. I'm the Marketing Communications Manager here at NAMI North Carolina, and we are thrilled to have everybody here for today's webinar. First of all, we would like to thank the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services for their support of today's webinar and all of the webinars that we have had this year. A couple of housekeeping items as we get started. If you have any questions for today's speaker, please put them in the Q&A section or the chat box down below, and we will answer them. We'll probably take some halfway through and then some towards the end as we have time. But if you'll put the questions there, that would be amazing. We will be able to see those. We'll also be sending out a copy of this recording and a feedback survey that we would love for everybody to fill out either by the end of this week or before Christmas Eve. So you'll have that. And now I'm honored to welcome today's special guest, Kelly Crosbie, who brings over 30 years of experience in providing and managing public services and supports for people with mental health and substance use issues, intellectual and developmental disabilities, and brain injury. She is currently the director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services for North Carolina Department of Health and Human Services. So that means she oversees the public community-based system for mental health, developmental disabilities, substance use, and traumatic brain injury in North Carolina. She's also served in multiple other leadership roles within DHHS, including Assistant Director of Behavioral Health at Medicaid, COO of Medicaid, and the Chief Quality and Population Health Officer at Medicaid. She's proud to be a licensed clinical social worker and a person with lived experience. That is a lot. And we're so excited to have you here with all of that experience to help frame our conversation today. Welcome.
Thank you, Amy. That is a lot. It's always hard to hear yourself, things being read about yourself. So thank you.
And
Thanks for having me. I'm super, super excited to be here today.
no, we're excited to have you because we think this is going to be a really great conversation, kind of wrapping up
Yeah.
2024 and then talking about 2025 with a, positive outlook about the work that the state is doing.
Mhm.
So as we get started, I want to take a moment to look back, though, at
Sure.
some of the work that the division has done over 2024, especially for mental health. What initiatives are you guys the most proud of as you're wrapping things up?
That's such a big question. And of course, I really struggled with that one, but it's a really important question. And I think, at the beginning of the year, we spent a lot of time talking with the community about like what should we be working on. And we put together our state plan for mental health, substance use, and intellectual and developmental disabilities. So, as a baseline, I know that's a very kind of like unsexy thing to talk about, but I'm actually really proud of that because it does identify like, here's what we're aiming for, here's our vision for the system, and here's what we're going to work on. So that's good. But I think when I said, well, let me get down to things I'm super, super proud about, in particular in the mental health space, I'd say there are actually two things. And then if you know me, whenever I say two, it usually means three or four. Okay. So like just be warned, Amy, it's really three or four.
Mhm.
But the first thing, it might sound uh, boring, but it's actually monumental, and the ripple effects of it are monumental. So spent a lot of time under the leadership of Secretary Cody Kinsley and the governor, really advocating for a lot of new financial investments in our state mental health and substance use system in particular. We also did a lot of advocacy for the IDD system. And we were quite successful. And that matters because I think it says it matters that we invest in mental health care. Like I think that really matters. And we've done a lot with those investments. But the single biggest thing I'm excited about in those investments, it may sound weird to you, is actually almost half of the money that we got, close to $400 million, were for investments in the rates we pay providers to provide mental health services. And and why does that matter, right? Like that matters such a great deal because for so long, if you were a person who was getting help in the public system, right, or you needed therapy, just something as basic as therapy, It's so hard to find a therapist because it's very hard to recruit therapists to come into the Medicaid system
Mhm.
because the rate of pay is it was so low compared to other insurance. And that's not okay. It is never okay for someone who's come forward and said, I'm ready for help, um, which is a big step. It's a huge step, right? To say I'm ready for help, then to be told, well, the closest therapist is 45 minutes away, or yeah, we can get you in, but it'll be 6 months, unless you want to pay out of pocket. And that these are just unrealistic and challenging choices that people have to make. So something like increasing the Medicaid rate so we get more people, more treatment providers coming to the Medicaid system, which also means the public system. Those folks in Medicaid will also take folks without insurance typically, which is
Mhm.
huge, right, for the whole system. So I'm really pleased with that. I think the other thing I'm pleased with, so I'm gonna try to limit myself to two, um, is our community engagement. Um, I'm really proud of the work that we did this year to try to genuinely engage with the community because that is the most important thing. It's always going to be important that we engage with legislators, right? With providers, with paid providers. But really, our system absolutely must be based on the people that utilize it, could benefit from it, have experienced it. And that's individuals in the system, their family members, their loved ones. And so we spent a significant amount of time just trying to build relationships and understand and listen to people in the system, people affected by the system. And I would include myself and my family. And that I'm very proud of that. And we want to keep that's the culture we wanted to have here, and we want to keep doing that year over year. And can I throw the third thing in? And I'm
Of
sorry, Amy.
course.
Um, I knew I would do it, but remember how I talked about all that money we got that kind of went into the formal treatment system?
Mhm.
And that's how it works. But then, because we knew that's what was happening and we are working on that, that we go to largely rates for providers and formal services, things like crisis facilities, crisis services, right? Those very formal services. We said, hey, we also get a lot of federal dollars, block grant dollars. And we're going to take a big chunk of that and we're actually going to put it out to communities because people don't just get services in formal settings. I can't even tell you the percentage, right? People need organizations like NAMI very much. Families need family support organizations. Individuals need peer organizations. They need faith-based organizations. They need their community-based organization to be able to talk about recovery and mental health and help them. So we put a lot of money into communities for organizations that help older adults, that help families and sibling groups, uh, folks who are LGBTQIA plus, Latino communities, AAPI communities, because we want people to have not just formal paid for services, right? We just want to build a community culture and empower communities where people are where they trust, where they want to go for treatment. We
Mhm.
want to make sure that those agencies were equipped with some funding and some support. So I feel extra proud about that.
Excellent. And of course, you guys have been doing great work all year, but as we've been both know, the work is far from done, right?
Yes.
There's so much left to do. So, what do you think might be kind of the biggest mental health care hurdle that North Carolina still needs to tackle and needs to start immediately?
Okay, that's almost impossible to narrow down to one. Um, we spent a lot, just to be to go back to 2024 for a second. We spent a lot of time building relationships, baselining kind of a system view, and talking about our goals. And because we got this money, we invested a lot in our crisis services, so alternatives to calling 911, alternatives to going to the emergency room. So we built a lot of infrastructure so people have behavioral health urgent cares and facility-based crisis. So year two, a lot of that's going to be about making sure that those investments we put out there continue. Some of those
Mhm.
facilities are still opening. But that also that we have a sustainable funding mechanism for them, and also we advertise them. Like yesterday, we just announced our new crisis pages. That's just part of our crisis services, like our plans for announcing crisis services to the world, because we can build everything that we want, but unless people know about them, trust them, feel comfortable going to them, even knowing what they are or how to ask for them, they're pointless. So
Mhm.
making sure that people know where to find these resources that are really alternatives to more medical or traditional kind of like hospitalizations or calling 911, we want to make sure they know about them. So making sure those investments are sustained is going to be a big priority. Access will still be a really huge priority. So we don't think by any long by any stretch of the imagination that that infusion of funding increases for Medicaid rates is going to mean professionals are going to come in the system. Access is a huge concern for us, and we've been trying to tackle access in many ways. One's, like I already said, really funding community groups and alternative spaces where people get care. This year, we're going to continue those kind of grants to communities. We're going to continue our faith-based work, our veterans work, our older adults work. We are now working with libraries and YMCA's. I don't want to get ahead of myself, but we'll be making an announcement about more supports for schools and telehealth in schools. We are looking at additional kind of statewide resources like we have 988, which I'm really proud of, but that was in 2003 at launch, really proud of that. But other maybe statewide resources so people can get treatment if they need treatment soon.
Mm-hmm.
We're proud of our partnership with NAMI and expanding the number of NAMI groups and NAMI SIB groups across the state. That's really, and on campus, NAMI on campus, like all of that's really, really important to us. So that kind of access, we want to continue to infuse those kind of dollars to build more community capacity because it's not just professional capacity, it's community capacity. We've put a lot into peer services. So standardizing and streamlining peer certification and opening up more recovery centers and peer respites and peer living rooms across the state. So more peer-led services, because again, we're never going to get enough clinicians to clinician our way out of this. And we're also really focused though on actually building that pipeline. We talk about that all the time, building that pipeline, but we are actually working with community colleges and colleges to say, look, you are pumping out folks with behavioral health experience, behavioral health degrees, social work degrees. What is the right way to get them to come into the public space? So access and capacity is huge. So the other prongs of that though is access is just it's good, but it has to be good access.
Right.
So we're very invested in quality. And that means a lot of things. It just means it's high quality, like the staff are well trained. They're using evidence-based models. Treatment is actually helpful and effective if you get it, if you choose to get it. More folks are willing to use medications for opioid use disorders, things like that. We have a lot of stigma around that still here in North Carolina. So we really want things to be high quality and high caliber and well-trained staff in our system, not just generic access, because that's not terribly helpful. But we also want it to be culturally appropriate, going back to our investments in Latino communities, Asian American communities. We need care to be culturally appropriate. It needs to be in older adult situations. It needs to be in veterans organizations. Like it needs to be where people are and where they care about faith-based organizations. So we'll keep building that up. And I think the final prong, which I think is something that we've got to keep working on, it truly is stigma.
Yeah.
So we need to keep building a network of care for people. And I hope you've heard me say all forms and fashions, everything from paid professional treatment to community-based help. We need to make sure it's good and high quality. Need to keep funding it, and we just need to keep working on stigma. So one of the things we've actually been working through is really some anti-stigma campaigns. One of the things I'm really proud about, or proud of NAMI for, is just helping to normalize the conversation for families. It's okay. Like mental health issues are so common. And it's a rare conversation you will hear me actually say illness or disorder. There's nothing to be ashamed about mental illness or disorder either. But I mean, 1 in 3 people have mental health or substance use issues. It's who we are as humans. Okay, cool. Doesn't need to define us. It's part of who we are. But so many people still bear that shame and the stigma in our culture. And we really want to do stuff to break down the stigma. It's okay to talk about freely, openly, and we should be helping each other. Like with things like NAMI, you guys educate, you offer support, you say, you're not the only one. And your child, please, I'm going to use words that I'm not using. Your child's not weird. Your loved one's not scary. No, my dad's not weird or scary. My relatives aren't weird or scary. They're people. They got jobs, they got lives. They happen to also have some mental health issues, and that's part of who they are, and that's okay. But I have the privilege, I don't forget where I have the privilege of being in the system for a long time, understanding it. I went to school for it. I'm a clinician, so I know treatment not everybody does, right? So it's a lot of people thrown into a world where they don't maybe understand what's happening with their loved one. And the information they get from the rest of the world is sometimes confusing. So you're really working on stigma. And that might be an unusual answer. We're going to do all kinds of very concrete programs too, very, very concrete programs. But part of our role here really is to set policy. And we set policy by what we fund, what we discuss, what we advocate for, and the
Mhm.
culture that we try to create in the state. So that's the priority for us next year: access, anti-stigma, and high quality.
Yeah. And you mentioned a couple of reasons why people might be struggling to get access, right? Like there's not enough quality providers. There's stigma in some of the communities remaining about seeking treatment at all. Um, do you think that there are other reasons why some North Carolinians are still struggling to gain access to good mental health care?
Yeah, I mean, part of our role, and it's not a role people traditionally think of, right? But I think part of our role is challenging um, private payers too.
Mm,
So, like, I spend a lot of my time working on supports for individuals with quite complex needs, often who are uninsured or who have Medicaid. Um, and that has its own issues, right? With lack of funding and poor rates and never enough state dollars for those who are uninsured. But that statistic, that 1 in 3 statistic of people with mental health issues, that includes people in the private space,
mhm,
people with private insurance. And I really think part of the issue too is that most private insurance, myself included, we don't have robust mental health benefits. We just
mhm.
don't. And so they're very hard to navigate too sometimes, right?
Yeah.
When you want mental health, you go to the back of your car, oh, you call that other company and you go through those hoops. Well, you lost me when I had to call another company.
Yeah.
You lost me. And that's not okay. So I think that's just an example. It happens in the public space too. It's an example of all the barriers and hurdles we have. So if somehow you get past the stigma, um, if I know my Mercy in Johnston County, we've got 35 therapists in a walk-in clinic, but you don't know and you don't know how to get it,
Hmm.
what point is it? So
Right.
we can build all the access, we can work on the stigma, we can make a confidential, safe, easy number for you to call, like 988, by the way. But you gotta, like, how to figure out how to navigate it or where you even go is something. I think it's a huge, huge, huge struggle. And it's a struggle for everybody, not just for people in the public system. It's a struggle for people with like private insurance. How do you go? So one of the things we are working on is an easier way to actually access care. So
Mhm.
yesterday I mentioned we released our crisis site. And so we try in very plain terms to say, here's what urgent care is, here's what a crisis team is, here's a map of, and just put your zip code in, and it'll tell you the nearest crisis center to you. We're just trying to make it easier, and we're trying to advertise the heck out of that website. But we want to do the same for basic care. We're finding that people call 988. 90% of people are calling 988 just for a referral or for services. Because it's easy, because everybody knows 988 and it's advertised
Right.
everywhere. And we don't need to reinvent the wheel. We just want to capitalize on that. So when people call 988, we want to be able to refer them to service, maybe even hand them over to a clinician, literally in those moments. So we're trying to figure out how just to make the easiest access to care that we possibly can. So you never have to figure out what number to call, what your insurance will cover or not, what your LME is. No one knows. I love you, LMEs, but nobody knows what you are. Because it's an artificial North Carolina type term, right?
Hmm.
And your average citizen, I talk to a lot of people and I say, if you wanted mental health care, what would you do? And they all tell me I would Google psychiatrist. And you and I both know that's the last place you want to
Hmm.
go, right? It's the most complex, most expensive, highest level need. Not everybody needs one. So what's that easy button door that's like a 988 where people can just call it, even get a virtual appointment that day or the next day, get a handy referral to somebody that's actually available and open. We just need to make it easier. It shouldn't be so mystifying.
Hmm.
But also, just so you know, Amy, like on our site too, we want to be like, here, click this button for an appointment. We actually want it to be that easy. Or call this
Hmm.
number and we can get you a clinician. Guess what we also really want to advertise? I think we even have you on our new website, our new homepage. Oh, it didn't come out, your new homepage. We want people to know where NAMI is.
Hmm.
We want them to know where First in Families are. We want them to know where the Down Syndrome Association is. Because these types of family support organization, you guys are vital. I can't say enough. So yeah, we want the paid supports in there, but we want the easy button for call NAMI. And there will be a local group and they will help you navigate and get the support you need for yourself and your family.
And that's an excellent reminder for me to put our helpline information in the chat for
Yeah, thank
everyone.
you.
Yes, and our website here. So, in case you're curious about any of that, I'm also going to, yours is NCDHHS at, is that nc.gov?
NC.gov. Yep.
Mm-hmm. So that's also some information. And one of the questions that we had from someone is uh, they mentioned not knowing about some of the initiatives that you're talking about.
Yeah,
Where do you post or advertise what's happening at DHHS? So one of the things I'm going to do is put the sign up sheet
great.
for your newsletters in the chat as well. People can
Yes.
use that. But where else can we find um, information about some of these initiatives?
I'm so glad that you asked. No, for real, I am really glad that you asked. Um, I want to see if it's up. We have one of the things that uh, was important to us was something we called our accessible language campaign. I swear I will answer your question in a minute, Amy. And that we've actually been working for a year in partnership with our CFAC. I don't know if you know what that is. It's a Consumer and Family Advisory Council. I know
Hmm.
you know, Amy, but some in the audience might not know, right? And it was to develop helpful fact sheets and information about our system and how to figure certain things out in the system. And it's an ongoing effort for us. We're working hard, but we just revamped our homepage of our website, and then we have a Get Help page.
Mm-hmm.
We released our crisis pages. It might have gone live, but the why? Here's why. Because you go to our homepage and it was chock full of great information. You couldn't find what you were looking for. It's just not particularly helpful. So we've revamped the web page tremendously. And so when you go in there, you will see things like right up front is who we are,
Hmm.
how to get help. And then it'll say, here's our advisory groups. You want to participate. Here's our strategic plan. Here's some data about how the system is going right now. Here's some help. If you need mental health help, here's some buttons. If you need substance use help, here's some buttons. We just drastically revamped it. So again, just on that website alone, we want to make sure that we're telling the community, this is our plan and these are the initiatives. Here's
Hmm.
some recent webinars that we did. And we have two things. We have our hot topics,
Hmm.
and you'll be sorry, you won't, I hope you won't be sorry you signed up, but you will get at least one, if not more, emails per week. And it is our commitment to the community. By and large, it's 90% us advertising initiatives that we are working on with partners in the community. Other 10% is helpful information you might want to know about Medicaid or some other initiative. So um, I think Amy put in the chat, if not, I will, our hot topics. But also we advertise on every single hot topic. There's two QR codes in the bottom, and they are how to get involved and do you want to come to our advisory committees.
Hmm.
We currently have 5 advisory committees running because we try to do things in partnership with the community. We got a big bunch of money for crisis and justice and child welfare or child mental health and workforce. And so we have advisory committees for all those. They're free and open to the they're free. Well, they're open to the public. We want your input. We value your input. It's our way to keep you updated. You'll also be able to sign up for something we call side by side. So hot topics
Hmm.
come out every week. Side by side is our once a month webinar. And again, that's our commitment to the community to keep you informed about everything that's going on. We try to be systematic, right? It's not like a 60-minute of everything going on. Like we usually do like pressing announcements and new things that happened. And this week we focused on what you can see from us in the child residential treatment space in this coming year.
Hmm.
Like we've just recently done one on workforce and all the workforce initiatives we're working on. We did one on the crisis system and all the crisis things that we're working on. So we try very hard to both tell you here's what's coming up, forecast it, and then periodically give you updates on all those initiatives that they're happening. But Amy, I'm so glad that someone asked that because again, I was it's one of those things that was surprising. Like people didn't know what was going on. They
Hmm.
didn't know what our job was. They didn't know what was going on. They didn't know how we were spending our money. And that's problematic. We are a public entity. We're here to support the public. We are public servants. We want you both to know what we're doing policy wise, but also to influence it heavily. Tell us
Hmm.
what we should do. But yeah, we've tried to make our website a whole lot better. But so you can go to our website, but please sign up for Hot Topics. You'll get one, probably it's more like 2 or 3 every week in your mailbox, letting you know what's going on, how you can participate in anything. And then every month we do side by side. But when you sign up for Hot Topics, you'll also get to sign up for side by side. And you'll get invitation for every, I think it's the first or Tuesday of every month. You think I would know? We do a webinar. Sorry.
No, but so the website, if I'll encourage everybody on the call today, if you haven't looked at it, go look at it. It's very user friendly. And we did have a question about signing up for an advisory committee. I assume all of that information is also up on the website as well, how people can get involved there.
It is. And the website that you see is actually not our new website yet. It'll be better than this. You're
Oh,
gonna love
okay. Well,
it.
great.
You're gonna love it. It's supposed to come out imminently. It'll be out by the end of this week, but yes, there are definitely ways that you can get involved um, on the current website, and that button's pretty much there, like how you can get involved.
Hmm. Okay, great. We'll look forward to that.
Yes.
So we've already been talking a little bit about some of your upcoming initiatives to improve
Yeah.
access to care,
Yeah.
including getting the word out about all of these community supports. Can you go in a bit more detail about a few of them?
Yeah, absolutely. So we just released our strategic plan. It has 7 component parts. I will just try to stick to the ones that have to do with mental health, but please know that there are 3 initiatives. One is very specific to intellectual and developmental disabilities. One is about our justice involved populations, who of course have mental health, substance use, and IDD. And one is about workforce. But in kind of in the mental health space, I've talked a lot about access because I'm pretty passionate about it. And it's very foundational, right? So one of the pillars is just about access, and you'll see all the things I talked about: anti-stigma campaigns, easy way to get into treatment, how we're supporting communities with more community-based options. You'll see all that. You will see a pillar all about crisis services. I mentioned those too. We're trying to make sure everybody knows about 988. So we continue to champion
Hmm.
988, right? So it's just a number you can call 24/7, call, chat, text. We still get about 8,000. It climbs every month, 8,000 callers,
Wow, yeah.
most of them looking for services. We also heavily advertise our peer warm line.
Hmm.
Our peer warm line is exactly what it is. It's staffed by peers. And we have a new product called Somethings, and it is a peer mentoring program with live peer mentors for this is for youth.
Mm.
This is new. They're all statewide. So we call that someone to call, someone to
Hmm.
call. We also have someone to respond. So next year you will see us really dig into our mobile crisis teams. I don't know if you've heard of this before, but when you call 988, we'll have an announcement coming out soon. 988 will be able to deploy and track a mobile crisis team. If it comes to your home, comes to your school, comes to wherever you're in the community. It's a mental health trained person. They don't have an ambulance, they don't have a police car. It's a mental health trained person to come help you and the family de-escalate the crisis. If you need higher level help, to go to a crisis center, if you have to go to the emergency room, depending on what you need. So someone to respond is really important to us. Okay, so we'll be working a lot more on that. And we have special teams, especially for kids, just so you know. They're called MOORS teams, mobile crisis MOORS. Get it? MOORS, MOORS.
Hmm.
Um, and then the last thing is a safe place to go. And I mentioned our crisis webpage. I mentioned the creation of new spaces, but we've created, I think 9 more what we call behavioral health urgent cares.
Hmm.
So you can go there instead of emergency room. We started heavily advertising where those are with a nice map. And then our facility-based crisis. It really is like a mini inpatient. It's a mini mental health inpatient is all that it is. But again, it's not a hospital. It's very dedicated to mental health. It's smaller. It's in community. It's not going to the hospital. It's not going in an ambulance. It's not going in a police car. So um, making sure that system is fortified, sustainable. We're continuing to oversee these facilities as they open, advertising it. But another important feature that we'll be piloting, you'll see an announcement at the end of the week, is our new non-law enforcement transportation. So if someone does need to be transported, we don't have to call police to transport someone.
Mm-hmm.
So we're very excited about this, right? Nobody, and police, this is not the appropriate role for police either, right? And nobody, if you're having a mental health crisis, I'm just being candid. If you put me in the back of a police car, it's not going to help me feel better.
Right.
It's not. That's just true. And we appreciate the police. This is not the position they should be put in either. Not anyway. So working on those initiatives, seeing them through, and updating the public on how it is affecting communities or people using these services is decreasing some of the negative things happening in the community. You'll see a lot of that. We are also focused on what people who typically are have the most complex needs. So let me talk about adults and kids for a minute. So adults with serious mental illness, okay? So this is not necessarily your young person who's feeling depression, school anxiety, needs a mentor, maybe needs some therapy, right? These are individuals, we know and love them. NAMI knows and loves these folks, right? These are people that might have bipolar disorder, schizophrenia, right? May have had it for a long time. We need to make sure that the services provided to them are really good. And there are two services we'll be really working on this year. One is something called our first episode psychosis program. I don't know if you've ever heard of it, but it's exactly what it sounds like.
Mm-hmm.
So imagine, it's 2024. And many of you have lived this, right? Many of you have lived it. You've got a 17-year-old, they have a psychotic episode. You truly don't understand it because mental health has never been the space that you lived in. Your child gets hospitalized, they get put on a load of medication. They come home and you get some aftercare appointments, right? And then you're kind of like left, right? It's terrible and it's hard and it can be a scary place to be for families. Our first episode psychosis programs are really life-changing. Those first episode psychosis programs kind of like wrap around that young person and their family. And they really help, they stay with them, they help to educate them, they make sure that their medicine's right and helpful and effective in the right dose. They make sure that young person goes back to school and finishes school, maybe goes on to more school, gets a job, gets in an apartment. I mean, it's just a really different way of living, right? It's not how it was 30 years ago. You didn't say, well, you have bipolar disorder, let's sign you up for disability. And if people made those choices 30 years ago, there's nothing wrong with that either. The world is just a different place. But we have a world now where we have actually really good services. They're just not well advertised. Where young people who have that first psychotic episode are being connected, their families are being connected, and the outcomes we're seeing are extraordinary. These are young people, and I know them and you know them. I know lots of people with serious mental health issues who have jobs and lives and get married and
Mm-hmm.
right. And the outcomes for these kids are astounding. As they grow up into young people, they go to college, they get jobs, their families understand what's going on, they get the support that they need. So we're really, really like people don't even know we have these programs, which is a shame, right? So we're really investing in those. And then on a total other end of the spectrum, you probably all know about clubhouses. You know what
Mm-hmm.
clubhouses? We have clubhouses in North Carolina. They've not gotten a lot of love for a very long time. And I had the privilege of going to several clubhouses over the years. And clubhouses, if you don't know what they really are amazing day kind of programs. They're houses, they're buildings in communities where people with serious mental health issues, adults can go. And it's a wonderful place. You can learn whatever kind of like job coaching or skills. And you actually just get to be with people who understand, with peers who understand what it's like to navigate a mental health issue. They help people in the community. I mean, they're wonderful, actually, evidence-based programs for people with serious mental health issues.
Mm-hmm.
And again, we are working with the clubhouses to just better support them. We think the success stories are tremendous. People who go to clubhouses, they don't end up back in the hospital. They maintain their recovery. They do well. They have friends, as they should, right? They live lives. And
Yeah.
so, again, clubhouses are a very important priority for us. So, crisis, priority. I'll have to mention the justice space, just in the mental health space. We're working super hard on everything. And for youth, too, it's really important that we don't live out youth. You know, it's so easy, and I think everybody knows this. It's so easy. Like go back to that crisis scenario, right? You got a
Mhm.
17-year-old has for whatever reason, which actually makes perfect sense, has a mental health crisis, might escalate. Well, how normal is that? Who doesn't escalate sometimes, right? And maybe things don't go well with the family and it escalates even farther, and somebody calls 911. So many bad things can happen in that moment. But let's just play out a bad one, right? 911 gets called, not mobile crisis, 911. Police come, things escalate. This 17-year-old who's really in crisis assaults a police officer and ends up in juvenile justice, potentially ends up in a youth detention center. So we're trying to, the crisis services we're building are also for those scenarios, right? Let's
Mhm.
get the kid a crisis response, right? But say that's not what happened. Say they called 911 and they insulted someone and they ended up in the juvenile justice courts. We are working on all the people that you don't even, like, people don't even realize we fund that are in family courts that meet these families and help get them into care, that educate the family court counselors and the judges on the array of services that exist in communities. So the child, instead of being adjudicated, they get deferred and they can go to treatment in the community. So we're working on like those folks that work with family courts and court counselors, right? We're funding more of
Mhm.
those, but also training them better. We're creating education materials for those courts. And then we are making sure, and this is going to take a while, y'all. You know, when I talked about access before being challenging, even when we have access to services, right? There are clinicians in an area, family programs. A lot of them will say, oh, there's justice issues. No, nope, I don't do that. So that's it. Talk about access issues. There's an even bigger access issue there,
Mhm.
right? Sometimes kids and families that really need help, right? And a momentary choice has been made, and it's a good one. Let's get the family and child into treatment rather than youth detention center. We got to make sure there's enough treatment. So that what I just described, we're doing the same for youth and adults,
Mhm.
making sure we're in the courts, educating the courts, making sure that we have enough treatment in communities. And then on the back end, this is for youth, but I'll talk about it now for adults. You and I both know we have a lot of adults who are in local prisons and jails that have serious mental health needs
Mhm.
that probably influence part of the reason they're in actually even incarcerated, right? So we're working hard on more programs to help with reentry. So that care management wraparound supports. We just released an RFP for housing, transitional housing, and
Mhm.
employment supports. And we are also working on something called FACT teams. You all know ACT teams, right? Assertive community treatment teams, right?
Yeah.
FACT teams are basically those. They're clinicians who are in communities, but they are trained to help people navigate their forensic issues, right? Because it's really hard. It's really hard to come out and deal with probation, parole, job requirements, having to go to AA and NA with no transportation and no funding. So making sure that our clinical teams who are working with folks with forensic experience actually know how to help is just really important to us. So a lot of our mental health work will focus on that. I mentioned access. We're not going to let up on that access. Amy, surprise, surprise, we're going to be coming to you and Holly saying, we love what you're doing. Let's have more
Mhm.
chapters. We're doing a really cool partnership with NAMI, y'all, like super cool. You guys are my hero if that's not coming through. And in February, there's going to be a CIT conference. So that is a partnership with us, led by the wonderful experts at NAMI, because we want to make sure that we're lifting up this notion of law enforcement folks who are well trained in understanding mental health issues, are able to de-escalate. Because we're going to build a lot of mobile crisis teams. We're going to advertise 988, but people are always going to call 911, right? So let's make sure that our officers are well prepared and trained. So that's another initiative. So there's a lot happening,
Mhm.
um, a lot happening next year. So that was a deeper dive on some of them, and that doesn't even touch all the ways that we're trying to enhance the availability of substance use services and prevention. I'm so
Mhm.
excited about the prevention things that we are doing or planning to do for youth next year.
Yeah. I want to take a minute and get through some of our
Yes.
audience questions because a lot of them are relevant to what we've been talking about. How is DHHS engaging with the community with some of the kind of post-election uneasiness with reports of budgets being cut or,
Yeah.
potential change in priorities? Are you able to speak to that at all?
Yeah, and we were being pretty strategic when we put out our mental health plan. We're required by law
Hmm.
to have a state plan for mental health, substance use, IDD, and traumatic brain injury because we wanted to say, hey, community, we listened. Here's the plan we came up with together. These are the things we want to work on. And so my goal is to make sure that the new administration is well briefed on those issues. I'm hopeful that we'll get good sign off on please continue with those things.
Hmm.
I'm actually looking forward. I that may surprise folks, but we have a new DHHS secretary coming in. I mean, I will miss Secretary Kinsley immensely. Um, because he was such a champion for behavioral health. But I'm hopeful that with the new secretary, we have a similar relationship, which was Secretary Kinsley said, these are the things that are very important to me. Please
Hmm.
make sure that we're addressing the needs of justice involved populations. Huge passion for Secretary Kinsley. And so we have. But he also said, I need you to do your job, Kelly. I need you to work with the community and find out what the needs are and focus on those. And I'm, I'm optimistic that that is the way the new secretary will operate too, because Health and Human Services is a ginormous portfolio. It would be highly unusual if a secretary came in and abolished all the priorities that we're working on in mental health, substance use, and IDD, said stop it and do this other stuff instead. I
Hmm.
think what's really cool about North Carolina too is that we have a lot of bipartisan support for mental health, substance use, and IDD. A lot.
Hmm.
You all, our constituents, you guys are quite successful at advocating for funding and programming in ways that not all other sectors are as successful in. And I don't, so that's good. And I don't see the General Assembly cutting mental health substance use programs. I just don't see it happening. And at the federal level, we the block grants we get, which are huge. This is how we fund things like NAMI. They're quite
Hmm.
huge. These are set in stone by Congress. It's very hard to imagine that Congress is going to come through and eliminate mental health and substance use services. It's just um, it's hard to imagine a reality in which that would happen.
Hmm.
Sometimes for the best reasons and sometimes for not so good reasons. People want to fund mental health and substance use services. Either way, it's still good funding that comes to the community. So I'm 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 feeling good and optimistic and energized. There will be change because there's always change, but our, you know, there's usually strong bipartisan support at the state and federal level for mental health and substance use.
Yeah. Um, do you know if there are plans to open one of these behavioral health urgent cares in the on the coastal side, eastern side of the state, Greenville, Wilmington, that area?
Yes, but it is yes, but there were two of them that were going to be opened, one in Wilmington and one in Greenville. There's still going to be two opened, but don't quote me yet on exactly where they're going to be opened. But they are
Hmm.
in process. I think the East is very unique. It's quite unique. And I hope my Eastern friends aren't like, well, why'd you pick Greenville and Wilmington? Only because it is so in the East, it's very rural. And we needed to pick places with some sort of population density because we can't really build an urgent care or crisis center that only one or two people come to. I would love to. I would love to, but we don't have enough money for that. So we had awarded money to a facility in both Greenville and Wilmington. They are in process. They will happen, but I think we had like a change of plan in terms of which provider is going to open them and stuff. But yes, they are in process.
And then you talked a little bit about the work that you're doing in workplaces.
Yeah,
So workplace mental health. Can you expand on this a little bit? We had a couple questions about that.
I'm looking for wish I don't have a copy in my journal. This is one of the very exciting things. We have partnered with the Triangle Business Journal. it's been several months in the making. They actually approached us about, we started with doing a panel on mental health in the workplace, mental health and wellness in the workplace. It was so well received from the business community that the Triangle Business Journal reached out to us again and said, can we do more? So we actually published uh, um, an entire issue of the Triangle Business Journal that is completely dedicated to mental health in the workplace. Another one will come out in March. We did two educational podcasts for them. And we are also talking about doing something called certifying mental health friendly workplaces. So that's all a
Mhm.
lot about the stuff. But what's the meat of it? The meat of it is it's exactly what you might think it is, right? We're all people in workplaces. Um, the statistics are alarming when you look at the number of people who are suffering in silence with mental health issues in the workplace, and their mental health issues are brought on by or exacerbated by the workplace.
Mhm.
So you may be having depression, anxiety. Boy, is that normal. That's so normal, right? Very normal. But you may feel like, well, I can't take a day off for it. I certainly can never tell it to my supervisor because they'll treat me differently. I won't get promotions. On the flip side, we actually have supervisors that we've talked with who are like, I know my employees, something's not right. I love and value this employee, but I can tell something is wrong. They're not their normal self and they're not, I don't know what's going on, but I don't know what to do and I don't know how to talk about it. So there's something that needs to change about the culture. So part of what we're doing is trying to change the culture, but also actually offer resources to business. And so
Mhm.
the journal article actually offers resources to business. And this idea of a certification to certify mentally health friendly workplaces is something that will offer further resources. And they're simple things. They are simple things like literally heavily advertising a mental health benefit, heavily advertising free and confidential lines, training all of your supervisors how to talk about mental health issues and that they're normal and to get rid of their ideas of stigma. Executives setting the culture of mental wellness. Being okay talking about, hey, I get a lot of stress as an executive. I go and get some coaching. They don't want to call it counseling, fine. They get coaching and counseling. That we offer things like mandatory lunch times or wellness breaks at work, meditation breaks at work, exercise breaks at work. So there are actually quite simple things you can do to change the culture in a workplace and offer benefits for your employees. Well, most employees actually do offer some sort of benefits, but it's not something that's always advertised front and center. And there's unique information in the journal, and there's unique scenarios that we have to think through after COVID and because of telework. More and more people are incredibly isolated. And that has caused a real shift in the mental wellness of workers. Oh, and the other thing I would say is that there's some special attention and will special attention be given to thinking through like workers are people too, and
Mhm.
sometimes they're fine, but their children are having issues and concerns, right? That affects their ability to be at work or present at work, that they're afraid to disclose, that they're quite worried about. And what are the resources available to them, whether everything from time off to benefits for their kids so they can actually help their children too. So I think it's that's a good example of access. When I talked about
Mhm.
access, right? We've so long focused on this like group of 250,000 people in North Carolina, and they're worth every minute of our focus. Please hear me say that. Every blessed moment of our focus. But statistically speaking, there are 2.5 million North Carolinians with mental health and substance use issues. Blows you away, doesn't it?
Yeah.
And that means we've got to do everything from push private insurers to be different, push for the culture to be different, push for supports in schools and supports in the workplaces. We're super
Mhm.
happy about that. And churches and YMCA and all those other places I mentioned.
And is some of that information that you guys have gathered on workplace mental health available for the public?
Yes, I have. You know what, Amy? You will not believe this. They delivered them yesterday. I was stunned. I feel like I have 8 large boxes of the journal. It's I'm like, wait, why do we have all these? I would love to get you some, but we've actually been thinking about because the journal, as you can imagine, is it's a private journal, right? So you've got to
Mhm.
pay. But I got all these copies I would love to share around. But in the meantime, too, the resources we talked about, we would just want to make them available on our website, right?
Right.
Things employers can do. We don't want you to have to be a member of the Triangle Business Journal to get support for you as a business owner or for you as
Hmm.
a worker to maybe suggest that your business or advocate that your business has these kind of support. So yes, stay tuned. Those are coming.
Great. And then could you expand a little bit more on the partnership with Some Things? I mean, that's
Oh,
primarily aimed towards teenagers, isn't it?
it is. Some things is it's a statewide opportunity. Anybody can any young person, and this really is kind of like 13 to 19 year olds.
Hmm.
It is a peer mentoring service. So it could be virtual, it could be talk or text. And this is for peers who need some mental health support, could be going through anything. We announced it as a Helene support,
Hmm.
plus it is a statewide support. So we want any teen to be who was interested to go ahead and use it if they want to. It's very easy to find. It's some things backslash North Carolina. So something slash North Carolina. It's free. You don't have to sign up, of course. You'll get paired with a mentor. Absolutely, they have bilingual mentors. Their matching is very good. They have a very diverse pool of mentors. The mentors are not teens themselves. They are young adults, like 21 to
Hmm.
25. They've all had their own experience of mental health issues and also navigating the system. It totally free. I'm trying to think what else. We are watching it carefully, right? This is kind of like a big deal for us to roll this out. Oh, and we worked extensively with Some Things to make sure that they had good protocols for what we all worry about, right? You always worry about like it's great they're talking to a mentor, but what if they need more help? What if there's a crisis? So there are very good protocols for like how they do handoffs to higher level of care, how they can get in contact with 988 if they ever need to get in contact with 988.
Hmm.
I think we've had about 500 kids reach out so far. We've had about 50 kids sign up and are currently using the service. And that feels good for a start. And we're okay with that right now because we want to make sure it's going well. We want to see that it's going well. And once we know that it's going well, we're going to advertise it full bore. But something we also want to advertise are like the NAMI sibling groups. I think that it's a different thing, right? But it's also, I know it's for young people, it's for older people, but that is, again, it's a good example of an amazing community resource for kids that we want, or not just for kids, but it is in some regards. But yeah, I didn't mean to get off some things, but I get excited about all the resources that are available and should be made more available. And we could advertise more so people
Hmm.
know about them more.
Yeah. Um, I have a couple more questions.
Yes,
Um, so, and also, if people have additional questions for your division and they want to follow up after this, do you
yes,
guys have a general mailbox that they can use, or is there a good way to contact you?
we do. And I'm happy to leave my email in the chat if that helps folks. Um, I'll just leave my email in the chat. I might be the person that can answer it, or um, I might introduce you to a team member that can help you better, but that's my email. You're always free to contact me.
Great. And how can, I mean, we've talked a lot about what we can do, our helpline and some of our other services, of course, but what are some other ways that communities like NAMI or other community organizations can kind of come alongside you all and partner with you on what you're doing?
I think I would urge you to sign up for Hot Topics and come to Side by Side. I would urge
Hmm.
you to sign up for an advisory groups. But I would also say don't, this might sound odd, but don't be shy.
Hmm.
I just put my email in the chat. Um, I I I am not naive enough to think that I know all of the amazing community programs in the state. I have no idea. But I have found and gotten to know and have partnered with some of the most amazing organizations in the state because they reached out and introduced themselves. We love it when you do. We want to know about you. We want to know creative ways that we can partner. But we also want you to know our resources too. Like, oh, you didn't know there was a grant that you could apply for because we think you're a neat program. So, yeah, please, my email's in the chat. Oops, it just went to host and panelists. That's my
I
bad.
copied it.
Oh,
We're
thank
good.
you.
Yep,
Thank
got it.
you.
Hmm.
But yeah, I mean, like, I mean it. Like, I always say I have an open door, but I do because it is. that is one of the funnest parts of my job, getting to know the community, getting to know folks, but also lifting up really cool, amazing work. I don't pretend that all the amazing work comes from Raleigh. Of course it doesn't. Of course it doesn't. And I think our best work is when organizations come to us and said, we need X, or this was happening in our community and we developed X to help.
Hmm.
Um, and we get to say, oh, fantastic, because yes, we're hearing about that in this community, in this community, in this community. This sounds phenomenal, and we would love to work with you on it. The whole idea of NAMI spreading their work on campuses and building new chapters across the state and working with law enforcement in kind of this unified statewide way, that came from our meeting with Holly and Lillian,
Hmm.
because my job is to listen to experts. And they were like, we can do X, Y, and Z. And I was like, phenomenal. We would love for you to do X, Y, and Z. So please know that we really want to know and understand the awesome things that you're doing and partner with you in any way that we can.
Yeah, and we had some mentions of other resources that could be added to the division's database, so I can get you some
Love
of that
that. Would love
information.
that.
Yeah.
And you might see in Hot Topics sometimes if you get it, we'll advertise. Send us your conferences, send us your opportunities.
Hmm.
We'll advertise them in Hot Topics.
Yeah.
I'll come speak at your things. We'll come and meet you all. I mean, we love to. So yeah.
The locations of clubhouses and upcoming behavioral urgent cares, are those going to be things that are also on your updated website when
Mhm.
it gets launched? Okay, great.
Yes, the right now the current urgent cares, you will find them on our crisis website. We announced
Hmm.
that in Hot Topics recently, so there's actually a finder, so you actually know where they are, so people aren't wondering where the nearest BHUC is. The same thing with FBCs; those are in there. What was the other?
Clubhouses.
Clubhouses. Yes, I think we're actually working with Clubhouse International right now and
Hmm.
talking to this. Would you believe there's only 7 clubhouses in North Carolina?
Hmm.
That's all. So we're actually talking with Clubhouse International about ways that we can support and lift up all of the clubhouses in North Carolina. But yes, one of the things I would very much like to do is we would love to advertise where clubhouses are, what they are, and that's coming.
Hmm.
But first, there's some um, uh, we want to make sure that we're clear on the vision for how we want to work with clubhouses. But I'm a big clubhouse fan, big clubhouse fan. Yeah, there are other psychosocial rehabs, not a lot actually in North Carolina, and I'm speaking specifically of the clubhouse model.
Hmm.
Yeah, only 7.
Well, obviously, there's still a lot of work for us to do, and we're extremely happy that we get the opportunity to partner with you guys on a, regular, like daily basis, almost trying to get some of this work done.
Yeah,
If anybody on this call represents a community organization that's also doing work that you want
yeah.
DHHS to promote, please reach out. They obviously, want to know what's going on in the state and be a part of it. Also, if there are questions that we didn't get to because there's no way we could cover all of this in an hour. Again, please reach out. And we will be sending the recording of this session and a feedback survey, a rather detailed feedback survey, including some questions that the division specifically wanted us to ask. So that would be a great opportunity to let your voices be heard, and because that information is going directly to them. Um, but I think we have run out of time, unfortunately. So, Kelly, thank you so much for coming
Thank you, Amy.
and
Thank you.
really just sharing your heart and your passion for mental
Yeah.
health with us. We're on a good trajectory, and we're really excited to be a part of what's happening in the state, especially as we get into 2025. Um, Again, everybody, keep an eye out for a follow-up email that will be sent by the 23rd. And also, our next NAMI at noon, we're already looking forward, speaking of 2025. Our next NAMI at noon is going to be on January 22nd and is going to be specifically about rejuvenation techniques for people who are either caregivers or in the mental health space, because it is important for us to also know how to take care of ourselves while we are taking care of others. So, until then, we hope that everybody has an outstanding afternoon and very happy holidays to all of you and Happy New Year. And again, Kelly, thank you so much. This was a great session and we look forward to the next one. So,
Yep. Thanks,
thank you
Amy.
all.
Thanks, everyone.
Take care.